Hello, I'm Dr. Winnie King, and welcome to Keeping Kids Healthy. This is a program about your children's health, and it comes to you from the lobby of the Children's Hospital at Montefiore in the Bronx. So you may see some people walking by or hear a few babies crying every now and then, but remember, the real action is going to be right here on the set. One of the most common issues facing caregivers of infants and toddlers is something doctors call otitis media. In other words, the dreaded ear infection. If you've got a young child in the house, you've probably dealt with it, the fever, the crying, the tugging at the ears. In fact, 50% of children have had ear infections by the time they're 2 years old. And for a lot of families, it's just a one-time occurrence. But in many instances, it can be a recurrent nightmare which needs constant medical attention and may even lead to surgery. I want to introduce to you our panel of experts today on this very important topic. First of all, we have Jody Yedvab, and she's here with her daughter Jessica, who came with you, but who's out having a good time exploring the hospital. She's 3 years old, and she has had ear infections ever since she was about 3 months old. So this is something that you're very, very knowledgeable about. And then we have next to you Nancy Maldonado, and you're also here with your son Austin, who's 3 years old, and he's also taking the guided tour of the hospital and having a wonderful time. We appreciate you being here. And then, of course, we have our expert, our true expert, Dr. Sanjay Parikh. You are the clinical director of pediatric otolaryngology here at Children's Hospital at Montefiore. And thank you very much for being here. Otolaryngology is one of those words that just sort of kind of makes people roll their eyes up in their head. But essentially, it means that you're an ear, nose, and throat specialist.
Exactly. Otolaryngology is the professional name for our specialty.
Yeah.
It's sort of a tongue twister.
That's right.
And ear, nose, and throat are what most people call us.
Well, we appreciate you being here
thanks
and
for having
sharing
me.
your knowledge.
Yeah.
Let's start with you, Jody. Your daughter was a little girl. She was about 3 months when she started having these infections. And what type of symptoms did she have? How did you know something was wrong?
She was irritable. She was pulling on her ears. She just wasn't herself.
And so you would go to the doctor. She was placed on antibiotics.
Yes.
And would that pretty much take care of it?
It would take care of it for 2 or 3 weeks, and then it would start all over again. So it was a constant cycle of being on antibiotics and then off. We tried every antibiotic there is.
And after a while, you start getting nervous about, becoming
She would
resistant.
Exactly, exactly.
So at some point, you had to make some real tough choices about what to do,
Yes,
because there's
we did.
some health issues, and we'll talk about that a little bit later. And Nancy, in your case, Austin started having infections when he was about 3 months old.
About 3 months.
And there was something going on in the house that may have contributed to that. His dad was a smoker, is that right? Even though he didn't smoke actually in the house, but did you have some concerns about that?
Not too much concern. It was just, being a first-time mom and trying to pick up on all the little signs to let you know what's
Sure.
wrong with him.
Sure, and we do know that ear infections seem to occur more commonly in homes where there's cigarette smoking, and so I know that was a potential risk factor that may have been at play with him, but regardless of what caused it, it was a huge problem, and there was a long span of time there, wasn't there, for him having an infection?
Yeah, he's been having it on and off since he was 3 months. So
Wow.
even until today, it's still going on.
And a lifestyle issue for you, I'm sure. How has that impacted you?
It's versus the tubes and the ears and not having it, but I have a good pediatrician who helped me through it.
Well, Sanjay, let's talk a little bit about ear infections in children, the symptoms, because you've heard different stories. Parents sometimes see different things in their kids, and they need to know what to look for. What are the symptoms of an ear infection?
Well, there's so many symptoms associated with otitis media or ear infections, and I think Jody and Nancy have mentioned a few. I mean, the most common thing is sort of pulling at the ears. A young child can't communicate quite yet, so you've got to look for other signs. Pulling at the ears, fever, general irritability, and inability to sleep, and also sometimes even something like diarrhea and vomiting can sometimes be from ear infections.
And the risk factors, because parents often ask, they ask me when I see them in my medical practice, what did I do? How did this happen? Are there specific risk factors
Well,
for
I
this?
think what I try and comfort families is, this isn't anybody's fault. This just has to do with the immaturity of the development of the ear. But there's certain other risk factors that we know could contribute. And we've mentioned a couple already, daycare, smokers in the family, a family history of ear infections, allergies, all those can contribute to give children a greater risk of having otitis media.
Now, if you are a parent and you take your child to the doctor, you're concerned that maybe there's an ear infection, what should the doctor do to make the determination that there is an infection?
Absolutely. Well, I think, always you've got to think history and physical exam. Your pediatrician should explore the history, find out what symptoms your child's having. Are there some of the things we talked about, the ear pulling, the fever, the irritability, and also physical exam. Have a look at that eardrum, see if it's red, see if there's evidence of pus behind that eardrum.
Some parents get really frustrated when they have one child that has an ear infection and then they have another child that doesn't have any. and they wonder, why is it that one child seems to get recurrent ear infections and another child in the family never had one when they were growing
That's
up?
the beauty of life. No two kids are the same.
There's no way to know. So there isn't there's no genetic factors at play per se?
Absolutely there are. We know that one child with otitis media or ear infection is more likely to pass it on to other children, but we don't know why some kids have it more likely than others, and it has to do with the way the development happens within the inner ear and middle ear.
Antibiotics, that's the big mainstay. You know, when you go to the doctor, you expect to be prescribed an antibiotic, you know, for this, because that's what you do. It's an infection and you use an antibiotic. And the question that parents will often ask me is, okay, look, we're over this. It's been 3, you know, ear infections in the last 6 weeks or 2 months. At what point is this child a candidate to have surgery, to have tubes put in the ears?
Right. That's the big question everybody wants to know when they come see me. Tubes, no tubes, what are tubes? How do we do this? What's going on? And I try and counsel families that tubes aren't always the answer for all families, but they can be for the select patient. And I think the child, there's 2 main reasons I advocate using tubes. One is the child who has recurrent ear infections. And I'm not talking about 1 or 2, I'm talking about 6 or 7 over 6-7 months. A monthly problem, recurrent trips to the doctor, and as Jody mentioned, an impact on lifestyle. That's the type of child that we'd consider for tubes. And the second child is one who's got fluid behind the eardrum that never goes away and is impacting hearing, and that child may have speech delay. So that's the other candidate that we think about putting tubes in. And once again, it's not for every child, but it's the one who has the more recurrent and frequent issue.
I think one of the biggest concerns that parents express is anesthesia. I don't want to put my child under. I'm afraid they won't wake up. How do I deal with that? How big of an issue is this anesthesia with this? You have to give anesthesia for this, right?
Absolutely. This is the most common operation done in North America, putting ear tubes in children, believe it or not. Most people don't realize that. And without question, it's always every family's greatest concern is, what is general anesthesia? Is it safe for my child? The statistics we give, children with otherwise healthy, driving to the hospital is actually more dangerous than having anesthesia. So that's one of the factoids that I like to give, make parents feel a little more comfortable with that day. But I think part of the way you counsel families is make them feel comfortable, have them meet their anesthesiologist beforehand. And at this hospital, we have parent-present inductions, which means the parents actually come into the operating room with their child while they go to sleep, and that really makes it a lot easier for them.
I'm sure that's very comforting for the patient as well as for the parent.
Absolutely.
To be there. What is the essence of this big controversy about tubes versus just using antibiotics? I mean, even within the medical profession, there are some doctors that just don't feel tubes are the right way to go, and then there's some that feel that that's really the only thing that will make this go away.
Yeah, I think that there's a lot of data. There's hundreds of papers being published on this very subject. Are tubes better than antibiotics, or antibiotics better than tubes? The thing about antibiotics that I'm always scared about is the development of resistance. I think we as physicians as a whole are right now over-prescribing antibiotics. We're not as judicious as maybe we should be, and that's resulting in these so-called superbacteria, these bacteria that are resistant to antibiotics. That's my concern, that when we're switching 3, 4, 5 different antibiotics, we're going to start having bugs that we can't treat anymore with antibiotics. And so that scenario, I think, is where we sort of think about tubes. I think that tubes aren't the answer in all children as well, and as I think Nancy pointed out earlier, that she doesn't feel her child needs them. And it's a child that doesn't have speech delay, who only has infrequent infections, I think that child doesn't need to have tubes. There's obviously a lot of controversy, and we don't have all the answers yet, but we do know with parent counseling, a lot of teaching, having discussions with a pediatrician, we can decide whether it is the right option for their child.
Okay. Well, now, Jody, you did opt for having the tubes placed in Jessica. I understand at one point you were even considering seeing a chiropractor.
Someone had recommended going to a chiropractor, and that scared me even more than anything else, is someone adjusting my child's spine.
Yeah, well, now let's talk about the surgery though. How did Jessica do?
She did extremely well. Like Dr. Parikh said, they allowed me to go into the operating room with her until she was placed under anesthesia.
Yeah.
And then at that point I went back to the waiting room.
And after she came out of surgery,
everything was fine.
She was fine?
She was fine.
And how did this impact the number of infections?
It reduced the number of infections.
Okay. Now, Nancy, you opted not to have the surgery for Austin. Instead, you've been using antibiotics when he has an infection. And how has he been doing? Has the number of infections changed? I know as you get older, it doesn't become as much of a problem. How's he doing now?
Well, he's doing better now. He has usually an ear infection like every month or every other month. But he's been with an ear infection since the month of December till the ending of March.
Right.
And that's when the pediatrician suggested that I would get him evaluated to see if he was a candidate for tubes.
Yeah.
And the doctor said that he was fine. He passed the hearing exam, and she said he's not really a candidate only because the ear infection is just like fluid just sitting there, but that the antibiotics would be good, and just to bring him back for a follow-up in a couple of months to see how he's doing.
And so the big concern for you was speech delay. you know,
Speech.
and they've tested that. He's fine. He's doing well.
Yes.
And so, you know, we have two cases here of parents that have made different choices for their children, and they both are doing well. And that's
I think they've both made the right decision
yes,
for their
particular child. Mhm.
And they've had great discussions with their pediatrician and their specialist, and I think it's wonderful what they've both chosen.
Yeah. Quickly, Sanjay, could you just go through the surgery itself? You know, what do they do when they put those tubes in?
Well, it's a rather sort of quick operation. It's about a 15-minute general anesthesia, where all the anesthesia is done through a mask ventilation. And it's a sort of, we put the children gently, you know, to sleep, and then they wake up the same way. And then ear surgery involves using a microscope looking into the ear. We do all the incisions through the ear canal. You would never know that your child has tubes, and the tubes are extraordinarily tiny.
They are, and
I
as a matter of fact, you
a-
have some. Let's
I
take
do
a look
have
at
some
those
here to
because
show you.
they really are so small. And
I have 3 different tubes here used for 3 different scenarios.
okay.
And they're very small. The inner diameter is about 1.1 millimeters or
Wow.
so.
And I think we have a picture of if we have that up on the screen or not
they're
of just
very,
how
very
tiny
small.
how
And
tiny
through
they
the
are.
ear and through the ear canal, we make a tiny incision in the eardrum, approximately 3 millimeters, so
Yeah.
very small. And then we put these tubes, which look like little bobbins, and we put them here. And the purpose of these is to let air in and let the fluid dry out inside.
Yeah,
And so
yeah.
it's like working like an automatic drainage system for the ear.
That's amazing. And it's just amazing how tiny they are and how well they work, because children do very well when they have them, and they also do well when they don't have them. I really appreciate you guys being on the show and sharing your experiences. And Sanjay, thank you so much. We definitely have to have you back again. You're fabulous. You know, it's so good to know that there are options out there. And remember that every situation is different, and that you should pick the option that's best for you and your child. And know that time is also a factor. As a child hits 5 or 6, the ear canal gets bigger and therefore less prone to infection. So there certainly is light at the end of the tunnel. Well, that's all we have here for today. We're so glad that you joined us, and be sure to come back next time for Keeping Kids Healthy.